Hi, my name is Rachel Surowiec, and I am a Purdue biomedical engineering professor in Indianapolis. Musculoskeletal health is the backbone of healthy aging, and so without our musculoskeletal health, the medical advancements and the impact of every other disease gets exacerbated. And so as we age, we have an increased risk for fragility fracture. And fragility fractures are common, they're expensive, and they're very severe. And I think that's something that's under-recognized. So osteoporosis is a disease that's going to impact your skeleton, and it makes your bones weaker or more brittle. And so that puts you at a higher risk of fragility fracture. And a fragility fracture is a fracture that happens under circumstances that normally wouldn't cause a fracture for someone else with healthier bones. And so we know that women are more at risk for osteoporosis. About 1 in 2 women over a certain age, once they hit menopause, will be at risk for osteoporosis or having their bones become weaker. But it's also really important to understand that men, as they age, also have a risk of osteoporosis. While less than women, about 1 in 5 men over a certain age will be at risk for their bones becoming more brittle. Worldwide, we have one fragility fracture occurs about every 3 seconds. And the cost to treat such fragility fractures is more than the cost of a cardiovascular infarction event, breast cancer, and stroke combined. And so it's really important for us to detect these early and to help treat people. But the way that we currently are detecting these events, it leaves a lot of room for growth. And so oftentimes, as somebody that experiences a fragility fracture, up to 80% of those people did not know that they were at risk previously. And so that's where my lab comes in. So the number of age-related osteoporotic fractures at the hip is actually on the rise, and those are our most severe with the most devastating consequences. And that's because of our aging population. People are living longer, and so the risk of having a hip fracture is actually increasing as we continue. And so these are particularly devastating fractures. Most people that sustain a hip fracture will go on to a decreased quality of life, and that's just because mobility is impacted. And so there's a length of time that a person needs to go through, hospitalization, get back to moving, and all of that time when you're not mobile is lost time to maintaining your strength as you age. Hip fractures are really marked by a loss of function and independence among our aging population. And so at a certain age, when somebody sustains a hip fracture, a good portion of these individuals will lose their independence and their ability to be mobile without assistance. And there's a statistic that says up to 40% of these people who sustain a hip fracture will go on to pass within 1 year. So our bone health is really important, and it very much impacts, not only our longevity, but our healthy aging years. So for combating osteoporosis, the first thing you want to be aware of is your risk factors. And so understanding some of the key risk factors such as aging, being a female, postmenopausal status, if you have certain diseases such as chronic kidney disease or type 2 diabetes, or on certain medications like glucocorticoids or even Ozempic, we know that those individuals are at higher risk of fracture. And so now you need to be your own advocate. And so knowing that you might fall into a population that has a higher risk, you talk to your doctor and we can get you in for screenings. And so a screening might look like a dual X-ray absorptiometry or DEXA imaging, and that's going to give your physician some indication if at your age and your sex, if you are at a higher risk than the average population for a fracture. And so beyond knowing all of that, just to take care of your skeleton, you want to stay active as you age, making sure you're out walking if it's safe, avoiding falls, of course, if you can still lift a little light weights. All of this we know is very good for the skeleton. And we all grew up hearing that, drinking milk is very important for your bones, get your calcium, but also you need to make sure you have a balanced diet, vitamin D, getting protein, and all of these things can help you, extend your healthy aging, your healthy years.